Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls today at 866-870-5752 right here in the studio. And right now we're speaking with Teresa in Whittier.
Teresa, Dr. Marc Darrow, that's M-A-R-C-D-A-R-R-O-W. Medical doctor, been doing regenerative medicine for over 25 years. And I'm so glad you called us up about your low back. And I just wanted to mention that we also do these procedures on the face called the vampire facelift to grow back the collagen in the face, make you look young, and we can do it on the head. If you got a little hair there, we don't do it on bald heads like Dr. Phil. And maybe it would work, but works a lot better when there's already some hair there. It regenerates the follicles, and we'd have to examine that also. Anything we do before we inject, we need to examine to see if it's something that's going to work or not. So Trish, I want to. You have low back with a bulging disc, but first I wanted to ask you, why are you on Eliquis?
Because I had 2 pulmonary embolisms in my lungs, and I had 2 blood clots in my right leg.
Gotcha. Okay. So Eliquis does not stop us from injections in the low back, so don't worry about that. There's no bleeding that takes that happens from that area. If we were going to do something more invasive, then we might decide to have you off the Eliquis for a day or so. But that wouldn't be the situation with the low back. That's a real safe area where no bleeding, even if you're on a blood thinner. So your pulmonary emboli were from deep venous thrombosis in your leg. How long ago was that?
That was in April 20th, 2021.
And how long do they want to keep you on a blood thinner?
They said for the rest of my life, because I saw a blood doctor, and he did all the sorts of blood tests to find out why I had the blood clots, and he told me it was a fluke. He said it was a fluke, and so that's why he said for the rest of my life I'll be on blood thinners. All
right, but he didn't find anything hematologically that was wrong with your blood.
Right? That's right.
Okay. Well, I would go see another doctor, get a second opinion. I always like second opinions.
That's a good idea.
You know, there's a problem with Eliquis, like any blood thinner. If you bump your head, you got a problem. Yeah, you don't want to bump your head, fall down, or anything.
Oh, you're right. Yes.
But anyway, I'm not here to tell you what to do with that, but I am here to tell you more about your low back, because that's the work that I do. So how long has your back bothered you for?
For quite some years now. I'd say about 3 years now.
Okay. And
I'm in physical therapy right now.
Okay. And is the physical therapy helping?
Somewhat, not much.
Okay. And then you mentioned you have bulging discs, so I assume you had an MRI done?
Yeah, I have an MRI, and I recently had an X-ray because I fell and she wanted to see if I fractured anything. And she said that my condition's still the same.
Good. Sorry you fell. It's no fun. I've done that a few times myself.
Oh, my God. Oh, my goodness.
Yeah, my worst were off the horizontal bar in gymnastics when I was younger, flying through the air and boom.
Gosh.
A lot of fun.
Oh.
Anyway, so bulging discs don't cause back pain, and everybody gets
osteoarthritis too.
Okay, well that generally doesn't either. It could,
and I have
theoretically,
like a sliding disc.
Okay, I don't know what that means, but maybe it means that the disc material has slipped. Yeah, maybe it's slipped through the material that holds it in.
Yeah, or something. That's what the X-ray said.
But you don't. Okay, you don't have pain down your legs, do you?
No, I don't.
Okay, so
I do have some pain in my right knee.
Okay, boy, you're fun.
I know. But the pain in my back is so severe. I have such bad pain in my back.
Okay. So just from what you're telling me, I haven't touched you yet to let you know for sure. If you came in the office, it would take me or Dr. Grove literally 2 seconds to tell you if we could help you. But we need to touch the area and see where the pain generator is. But what from what you're telling me, you have a sprain in the ligaments in your back.
Oh.
Which is causing the pain.
Okay.
All these other things are what I call red herrings. You know, it's like you're holding your hand up in front going, hey, this is what's going on, but the other hand behind you is the real truth. I don't know the answer to that, but we treat these all day long, what you're talking about. People come in with arthritis in their back, with bulging discs, and we get them better because that's not where the pain is coming from.
Oh, my gosh. That's awesome.
Traditional medicine thinks it is, and thank goodness no one offered you surgery, right?
Only I had bad feet before, and the podiatrist told me my feet are bad because of my back, and he wanted to do surgery, so I went to somebody different. I didn't want to have surgery.
No. You know, I always say this, once the knife goes in, it doesn't come out. You still have results, what we call sequelae or side effects. There are surgeries that are done that come out very, very well. I'm not putting all surgeries down. But look, why take the gamble? I had a surgery on my right shoulder when I was in medical school, fourth year of medical school, and I was very excited to get it because I was doing a lot of surgeries with my boss, who was an orthopedic surgeon, and I was like, you know, my shoulder was sore from a weightlifting injury, and I thought, let's go for it. He wanted to do it, and it came out terrible, and it trained me that surgery is not the answer.
I'm sorry, you know, also I have I'm going to have an MRI on February 1st on my shoulders. I have pain in my shoulders.
Oh, boy.
I forgot to mention that.
Okay.
The back pain is the worst, though. But what happened was my right shoulder, it locked. I couldn't move it one morning.
Okay.
And I was in excruciating pain. And so that's when I thought I better make a doctor's appointment. And that's when I did, because my shoulders have been hurting for about a year. But I've been able to do my activities still. It's just there. And so then when my shoulder locked up, that's when I called my doctor, and she said, it sounds like you have tendinitis in your shoulders.
Okay. Well, that's easy to fix. We know by touching, not by looking. Okay. So I don't trust any MRIs or X-rays. I like to get them because I found a couple cancers I wasn't looking for.
Oh, my God.
Yeah, I've saved a few people's lives by getting MRIs or X-rays.
That's awesome.
But it didn't help me with the musculoskeletal pain issue. That's done by touch. That's done by examination. Yeah. I mean, it's rare, but it's happened. There was a lymphoma I found once in a lung looking at a shoulder X-ray.
Oh, my goodness.
Yep. There was a breast cancer we found with the shoulder imaging. Yeah, that was done actually with ultrasound imaging.
My goodness.
I had, this years and years ago, I had an ultrasound tech doing ultrasounds of every patient who came in. And I said, please do that shoulder. I'm going to come in there in a minute, do it before I get there. And he came out of the room and he said, and he was whispering, he says, Mark, she has cancer. And I go,
and that's when you found the cancer?
Well, that was one of them we found, yeah.
Oh, my God.
And I don't want to get people riled up about they've got cancer if they've got pain, because the two are not necessarily at all related. It's like an ancillary finding. You know, if we did an MRI of everybody's body, we'd find all kinds of stuff that we think we shouldn't have. No, I'm serious. So. There's all kinds of stuff we have that is not causing a problem. Some is causing a problem we don't know about yet. But there's a lot of stuff that goes on that we don't die from. We die with it. A lot of men have prostate cancer as they get older, but they don't die from it. Some do.
My uncle had prostate cancer, and he lived. He survived it.
Yeah. But some of them are non-aggressive forms. And,
True.
You know, you can have your PSA go up, prostatic specific antigen, and get nervous about it. But it doesn't mean that you're going to have a problem from it. Sometimes you do, sometimes you don't. I have a very good friend who has prostate cancer. and he found it because he had problems breathing, and yeah, it had spread to his lungs, so they put him on hormone therapy, and that cleared up immediately. And
oh my gosh!
I talked to his doctor, who said he should live a normal life. These medicines are amazing.
Oh, that's wonderful.
Yeah, he's got metastasis all over to the bones and lungs and whatnot, but hopefully it doesn't affect. Hopefully he's going to survive another 20 years, 30 years, like normal lifespan. Yeah, the medicines are so good. It's not going to work on everybody, just like nothing is going to work on everybody. But so far it's working for him. Look at the HIV patients. You know, back in the day, in the 80s, all my friends with HIV died.
That's right.
Now people are living a very, great life with the medicines if they take them. So, but anyway, my point is we've got to examine the body, find out where your pain is coming from. The knee, your right knee, same issue. We've got to move it around, touch it, use the ultrasound to look inside and see, if we find something that we think we can help. Because using platelets and stem cells really heals most things in the orthopedic realm, in the musculoskeletal realm. It's not going to heal everything.
My shoulders too?
Well, we got to check you out. But I've done both my knees, both my shoulders, and my back, and I'm doing great.
Oh, good. I want to be great too.
Well, you're already great.
I want to be great.
You're already great. It's just hopefully we can make you feel a lot better.
That's how I want to feel. Oh my goodness.
Anyway, God bless you, Teresa. We're going to send you, for calling, and we'll send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, and I'll pay the postage. And if you want to come into the office, the phone number there is 800-300-9300. If there's something that we didn't talk about, you can get a free consult on the phone with my staff. And,
great.
And we'd love to.
Okay, that sounds wonderful.
We'd love to see you. And then go to the website. You can actually watch me doing these procedures on shoulders and backs and knees and all over the body. And that's www.jointrehab.com. So, Teresa, God bless you. Your call has helped many people, and we really appreciate you.
Thank you.
Thanks, Teresa.
.com or .gov?
What's that? The website is www.jointrehab.com.
Okay, thank you so much.
All right.
Thank you.
Have a good one. So,
our number is
866-870-5752. So it's kind of funny. I always say I'm always looking for emails with people's questions, and one just popped up on my computer. Let's see what this says.
Okay.
I would like to schedule an appointment for prolotherapy. That's an old type of treatment. I'll tell you what it is in a minute.
Okay.
To treat my neck and left shoulder, please. I've been told I will need surgery for both. Bah humbug. Don't go for that. And would like to see if this therapy will help me. Thank you. Most likely it will help. Prolotherapy is what we used to call regenerative medicine, and prolo meaning proliferate, therapy meaning to treat. So proliferate what? Proliferate or stimulate new tissue to grow. Back in the old days, it was mainly using sugar water, concentrated dextrose mixed with lidocaine or Serapin or some other local anesthetic. And we also would use things like sodium moruate or zinc sulfate, and they stimulate an immune reaction, draw fibroblasts to the area, which are cells that grow collagen. So it's not something that I tell people to do. If they want it, I will do it. A lot of my patients from the old days will come back with a new injury and say, let's do prolotherapy. And I go, we got stuff that's much better. It's called PRP, platelet-rich plasma, where we simply draw your blood and spin it, inject it, or we can do that mixed with your stem cells. And they're both very simple, easy procedures to do. You don't need anyone to drive you to the office. You come in, and we do the procedure, you get the injections, and you walk out, drive yourself home. No big deal. The biggest side effect is a little stiffness afterwards for a day or so, sometimes longer. but nothing terrible. And like any injection, we have to be careful where we put the needles. And Dr. Grove is doing all the injections now, uses ultrasound for, I think, almost every one of his injections. And he has been trained better than anybody I know on the planet in regenerative medicine and ultrasound techniques. So, most neck pain and shoulder pain is sort of a tendonitis or ligamentitis. Even if someone tells you, even if doctors say, you got a herniated disc, that doesn't necessarily mean you're having pain. Or you've got arthritis, that doesn't necessarily mean you're having pain. Nita, is that you breathing again?
No, I think you heard the wind from outside.
I think I heard Darth Vader.
That's possible.
Anyway, give us a call right now. And the phone number to the studio, the radio, is 866-870-5752. And if you want to call the office and get a free consult with my staff on the phone number is 800-300-9300. So let's see, I'm going to go to another question. I love these questions.
Yeah, they're interesting.
Okay, here's a good one. Complex meniscus tear. Oh, that scares me. I'm kidding. So this person says, I have a complex tear of the meniscus in the right knee. Guess who else has that? Yours truly. Okay? I had an MRI when I had knee pain just to check it out, and it showed a complex tear of the medial meniscus.
Ouch.
Person says, I would like to avoid surgery. I did avoid it, and I'm very interested in having the stem cell therapy. Bone marrow aspirate concentrate injections, very simple. We just numb up the area in the back of the pelvis, put a needle into it, and aspirate the bone marrow. It takes me about 10 to 15 seconds to do the whole procedure. Dr. Grove is the same. He's done so many of these in his training, and he's done lots of them with me. And can you please advise on the recovery time following the injection? There's no real recovery. It's simple. You walk in, get it done, and walk out. If it's in your knee, we're going to want you to stay off of things like stair climbing or sports for at least a couple of weeks. Come back, let us inspect you again and do an examination and see if you might want to do another injection or whether you're fine. A lot of times people will do one injection and be okay after that. A lot of times they'll need more. How do I know ahead of time? I never know. What is the estimated time for the meniscus to regenerate following the injection in terms of weeks or months? So I've injected my own medial meniscus on both knees, and a lot of regrowth has taken place, but they're not completely like brand new. There's still, you can tell there's tears. They're a little bit extruded out of the joint. And the reason I'm not injecting anymore is because I don't have any more pain there. If I had more pain, I would inject more. So people might say, well, don't you want it to look perfect? No, we don't need it to look perfect. We need it to feel perfect. So could we make it look perfect? Sure. We just need more injections. It'll eventually fill in all the divots in the meniscus. So complex tear, baloney, who cares? Get some regenerative medicine, get platelets or stem cells, and heal it up. What is the recommended level of activity while the regeneration is occurring? Minimal. You want to leave it alone. You do want to move the joint, but you don't want to be pounding on it and injuring the tissue that's growing. You want to let it grow. And the person goes on to say, I just had a steroid injection to manage the pain. Uh-oh, bad idea. That's going to hurt that meniscus, and it's going to hurt the cartilage. So whoever did that to you, I don't agree with them. I know it's the standard, but I just don't agree with it. And I've had patients who have come in with multiple steroid injections whose cartilage is worn away because of it, much worse than before they started. Is there a minimum time frame from having a steroid injection to having the stem cells injection? I like to wait at least a week afterwards. Let that steroid kind of drain out of there. Thank you in advance for any information you can provide. kind regards, and thank you so much for doing the work that you do. We love you, Dr. Darrow. Oh, that warms my heart. Thank you.
He actually warmed my heart, too.
Yeah. And, the thing is, Dr. Grove and I have a warm heart from, I think, the way we were born, but we love the work we do every day when we meet in the hallway or we talk about patients. We laugh at how fast people heal. And we have people that have had multiple surgeries that got worse, and then we do regenerative medicine, platelets or stem cells, and some get better immediately. Some don't. I can't promise anything. We have patients sign a consent that says there's no guarantees. A lot of people say, I don't want to do it if you're not going to guarantee it. And I go, don't do it. Go get your surgery. See how you do then. You'll be back later. And that's very common. People will come in on the verge of having a surgery. I try to talk them out of it. They still do it. And then after the surgery, they get worse, and then they come back. And then very often, even after a surgery, stem cells or platelets can heal that area up. Sometimes it can't. If you have a prosthesis put in, metal or plastic, a joint replacement, there's not usually a whole lot that we can do to help that. You've got to go back to the surgeon and see what the problem is. And I've had so many patients come in after joint replacements that have failed miserably. I'm not putting it down. I'm just saying be careful. If you have other options, definitely don't do a surgery if you don't need to. So many people have grown up in the era where surgery is king. It's not anymore. Regenerative medicine is taking over. Platelets and stem cells can heal most of these issues, not everything. If you get your knee smashed by a crowbar or a car ran over it and there's nothing left, you're going to probably need a knee replacement. But that's generally not the case. It's usually people have some arthritis and the surgeon says, well, you need a knee replacement. If you don't get it now, you'll need it later. I laugh and I go, tell the surgeon he needs one. Nita, you're not laughing.
Well, I'll laugh now.
All right, good.
I didn't want to interrupt you because that's pretty important stuff you're talking about.
All right, here's an interesting question. It says, soccer player, ACL, leg fracture. Let's see what this person has to say. Hi, I'm a 31-year-old soccer player who would love to get back to playing for fun, especially now that I have 2 twin boys that will grow up to play, if they choose to play soccer. Oh, show's over.
Oh, dear.
Well, get a hold of us at the office. You can call the staff, get a free consult on the phone, and that's 800-300-9300. Or go to the website, www.jointrehab.com. You can watch videos of us doing these injection procedures with PRP, platelet-rich plasma, and stem cells. And thank you, Nita Valens, for being a great host. Thank you, Alex, Suzette, and the rest of the staff. God bless you all.
You've been listening to Living Pain Free with Dr. Marc Darrow. And now that you've heard Dr. Darrow, call his office at 800-300-9300 and speak to one of his joint rehab experts for free and ask for a copy of his book, Stem Cell and Platelet Therapy. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.